Hello, I'm Dr. Amiya Prasad. I'm a cosmetic, oculofacial, plastic, and reconstructive surgeon practicing in Manhattan's Upper East Side and Garden City, Long Island. When you're choosing a surgeon for your eyelid surgery, I recommend you look for 4 critically important factors before you make your decision. I'll discuss these factors in more detail after I list them out. Number 1, expertise. Number 2, experience. Number 3, artistry. And number 4, commitment to providing you the best care possible. When it comes to expertise, I have a very straightforward philosophy. I believe in super specialization, providing the best care possible and having the expertise to be able to do that. Now, what does that mean? In my background, I first trained in eye surgery. After that, I trained in plastic surgery of the eyelids and the face. So that field is called oculofacial plastic surgery. Many people are not aware of this and they look for a general plastic surgeon for eyelid surgery. And although general plastic surgeons get exposure with eyelid surgery, many don't get even close to that level of experience when it comes to understanding a lot of the complexities of eyelid surgery. The reality is that when it comes to problems or anything that would happen that is unexpected, all doctors in every specialty that does surgery of the eyelids will always look for an oculoplastic or oculofacial plastic surgeon to assist them to help them with their problem. So in my opinion, being a super specialist is the type of doctor that other doctors would go to. And certainly in my practice and doing eyelid surgery for 20 years, I've definitely seen that. We have had many people who are physicians, physicians' spouses, physicians' relatives. When they do their research and they look for the best doctor for an eyelid procedure, they look specifically for the highest level of expertise. In addition to that, I actually focus my practice on cosmetic eyelid surgery. And although there are many complicated procedures related to reconstructive eyelid surgery, a lot of them get incorporated into my expertise and my experience with cosmetic eyelid surgery. So there are many ways to look at this, and one way that I like to explain to people is that many plastic surgeons can do good eyelid surgery, but very few can do exceptional eyelid surgery. So does experience matter when it comes to eyelid surgery? Well, having performed eyelid surgery for over 20 years, I can tell you it absolutely does. No young surgeon wants to hear that, and certainly surgeons have no shortage of ego. Being exposed to something, doing a few cases is one thing, but I'm speaking to you from my operating room, which I built after so many years of experience. And I can tell you that there are, in many fields, including the music field or being a musician, where you reach different levels of ability and dimension of feel when it comes to surgery. And Malcolm Gladwell, for example, talks about the magic 10,000 hours that it took bands like the Beatles before they became exceptional. And I have to admit that now that I've been doing this for this long, that it is really true. Experience matters, but experience in the area that you're working in, not just letting time pass by. So at this stage of my career, I have done so much eyelid surgery and have dealt with so many issues and have a level and depth of knowledge and understanding that, frankly, there are times I don't even know why I know something, but I know it and I know exactly what to do. An example that I like to use is the pilot who landed that plane once it took off of Kennedy Airport and got some birds into its engine and had to land in the Hudson River. Thanks to his years of experience as a pilot, he knew exactly what to do, he did it in a calm way, and he did what needed to be done. So, in so many ways, performing surgery is like flying a plane or being a musician. And having the experience and doing something in many ways over and over, you develop a depth of confidence and knowledge and ability such that whatever you're doing, you've done it before and you've done it well and you've succeeded. So how many years have you been doing this, and how many cases a week do you do? What are the quality of your results? Can I see examples of your results, and your results, not just some generic format?
Dr. Prasad has been practicing his surgical artistry for over 15 years and has received many accolades from far and wide for his living art. Dr. Prasad is a visual artist and has been passionate about the arts for all of his life and has integrated this interest into his medical career in a very unique and very productive way. His innovative approach, his compassionate manner, and his gift of artistically restoring youth to patients all over the world is the reason that the Long Island Arts Council at Freeport is proud to honor Dr. Amiya Prasad with this year's Artie Award.
Artistry is such an important aspect when it comes to choosing a cosmetic surgeon. I can tell you that having been an artist and being honored as an artist, that it's a real gift that either you have or you don't. And it certainly sounds self-serving, but I have trained and taught hundreds and hundreds of doctors, and I can say from experience that judgment and perception of beauty and balance is something that is intrinsic. It's not something that is in a protocol. Medicine tends to attract a lot of people who have, we call them square personalities, where they're all about order and discipline and steps. But artistry is about a sense of balance and dimension. And so when I look at many of my journals where colleagues write about procedures they've done and they show off about, and I look at them and I see, well, something is really off about the way people are seeing their patients. And if you really want to get a sense of this, you can go to the Upper East Side of Manhattan or to some of the more affluent areas of Long Island and see a lot of the, quote, bad plastic surgery. So when it comes to choosing a doctor, you need to just get a sense of how artistic are they. And if you look at their work, and probably the best way to judge, in my opinion, is do their patients, does everyone look natural? And if you look natural, then you're really, as an artist, you're retaining the character. And the character of the face is so important to retain. And as strange as it may sound, that looking natural and looking like you didn't have something done requires skill, it actually takes a lot of skill and a lot of judgment. It's not how much you do, but it's also how much you don't do, or how you do the techniques you need to restore the character of a person's face that has been affected by aging changes. So for example, when lower eyelids are sagging, you don't want to pull them up super tight, you don't want to take away too much skin. You want to create beautiful almond-shaped eyes if this person had almond shape before. And even if they want it slightly enhanced, that is artistic judgment. So artistry is very, very important, and I'm hoping that this is a useful guide for you to make your decision. When I say commitment, I mean commitment to taking care of you in the best way possible. Now that can mean a lot of things to a lot of people, but I can tell you what it means to me. When I was in training, when I watched many of my extremely well-respected colleagues taking care of their patients, I saw a lot of things that I just didn't like. I didn't like the way that cosmetic surgery patients were being treated like sick patients in a hospital, and there's a lot of depersonalization where you are very vulnerable and very exposed. More than that, the individual attention to one person is diluted. Whether you're in a surgery center or a major hospital, it'll be like one staff person, like a nurse, who's taking care of multiple patients. I always thought this is one of the most important days in this person's life, and if it were me, I would want all the attention on me. So in my practice, we have gone out of our way to make sure that the personal level of care is exceptional and that every person feels relaxed and feels good about being here, and the passion and caring and commitment of my staff to making this an excellent experience has been continuously reviewed as very positively by our patients. In addition, I'm very committed to ensuring a quick recovery. And now what that means is doing procedures in a way so that you have as little time as necessary getting anesthesia. And when you talk about anesthesia, I basically do all my procedures under local anesthesia with a little bit of intravenous sedation, liquid Valium that goes in the IV or intravenous, so you feel very comfortable and relaxed. But more importantly, you're able to recover very quickly. You can go back to your normal life sooner rather than later. Unfortunately, a lot of people have general anesthesia where there's a tube in their throat and they have to go on a respirator. They need some extra time to recover, and that's something I've essentially eliminated, not just from eyelid surgery, but from facelift surgery and the other procedures that we do in our practice. I feel a personal commitment to my patients, and that commitment extends beyond the one surgery that I may do for them, whether it's removing bags from under the eyes or helping them with hooding over the eyes. I'm committed to helping them look their best, whether it's surgical or non-surgical. And to that, what I've done is I've developed this spa, and that's where we're speaking from right now, where non-invasive skin care is provided at a very high level comparable to my surgical care. We have a skincare line, again, with the commitment for helping you look your best regardless of the stage that you're at, whether you need surgery or you don't need surgery. But we are committed to helping you look your best. So that passion and that commitment in caring for you and being your doctor through and through, and not just being a technician who does a procedure, I think that's of high value and is something you should look for when you're choosing a surgeon.